Hi, this is Dr. Tamson. She's a therapist for eating disorders. So I'm going to ask her a couple questions. One of the questions I want to ask you first of all is exactly what is an eating disorder?
Well, eating disorders are characterized very specifically in the DSM.
Mm-hmm.
And so in order for someone to have an eating disorder, they have to meet those criteria. From my perspective, it's really when somebody really develops sort of an addiction process
Mm-hmm.
and an emotional dependency process around managing feelings, emotions with food.
Okay. So what is the importance of social intelligence, you believe, as a therapist dealing with patients with eating disorder?
I actually feel like a lot of people who struggle with eating disorders have difficulty with social intelligence.
Mm-hmm.
And so that is actually part of the educational sort of two-track way of treating eating disorders. There's a cognitive piece and an emotional piece.
Mm-hmm.
And I would probably address social intelligence on both tracks, but one is educational,
Mm-hmm.
sort of teaching people about it, and then processing their emotional response to that.
Okay, and as a therapist, how do you believe being really knowledgeable with that can help the patient with an eating disorder? So as far as your
Yeah.
own skills.
Okay, well, probably the most important piece is that clients who struggle with that sort of stuff also are not entirely aware of it.
Yeah.
So my job is to really help sort of shine a light on the areas where they maybe have some blind spots.
Okay.
And I'm not sure if I answered that question.
Oh, no, yeah, that's really helpful. And as far as with emotional intelligence, in what ways do you believe it's really important for a patient with an eating disorder to be aware of their, emotional environment and as well as their own emotions within themselves?
Well, if clients are not able to identify and respond to their own emotional states, then I really feel like that would exacerbate and probably even further maybe entrench them in their eating disorder, because if the eating disorder is utilized as sort of an emotional coping mechanism,
Yeah.
which is also exceedingly detrimental to them
Yeah.
emotionally, physically, medically, then without the emotional intelligence piece, it's very hard for them to move forward.
Yeah, and as far as dealing with face saving, a lot of girls with eating disorders like to put on a show, correct? How do you believe it's important to break down so that they feel comfortable enough to disclose important information that may be very personal to them?
Well, carefully.
Yeah.
That face saving, as you describe it,
Yeah.
is a lot of times really rooted in guilt and shame.
Mm-hmm.
A lot of shame about who they really are, and there's a discrepancy between the persona that they project and how they feel on the inside. And so, it's my job to very carefully walk into those painful spaces with them and help them disclose what's going on for them, which I think, eating disorders have a lot of secrecy.
Yes.
And so asking somebody to just break down that wall is very scary.
Yeah.
And so to kind of repeat myself, carefully. The answer is carefully,
Makes sense.
slowly and
Yeah.
gently.
Yeah, and I know with communicating with them effectively, I know paraphrasing must be something very, very detrimental to your work, because I know patients have to be aware that you may not totally understand them, so I know when it comes to paraphrasing, that may be helpful, won't it?
Oh,
As far as feelings when they
okay,
inform
so
you of
when you say something to me, I
and-
say, okay, so it sounds like you might
Yes.
be saying this.
Yes.
And then are you asking me, is that really hard for clients if they feel misunderstood?
Yes.
Yeah.
Yes.
Yeah, that can be a tough one, especially if somebody feels like not only did I not get them, but was I perhaps hearing them in a way that caused me to judge?
Yes.
So I have to be really, I think what you're asking me is, do I have to be really careful about
Yes.
that? The answer is yes.
And as far as communication climate, because I know there are group therapy, when there's tension in the room due to one client, how do you as a therapist deal with, trying to make that climate go down so that the other patients aren't as anxious?
Well, a lot of anxiety from my perspective is rooted in the things we can't talk about.
Yeah.
And so my goal in group, as well as an individual, but my goal in group is to really not expose, but to bring into the discussion what is happening right now, what do we see going on now, and not have something be like an area that we can't go into.
Yeah, and do you think it's important for the clients to be able to be aware of this, climate of intensity or anxiety? So,
Well, I think they're aware of it.
I am sure.
Do I think that it's important to talk about it?
Yes.
Yeah, they really need to be able to be open with, allowed to kind of share their experience. Yeah, and that's really something I encourage.
Okay, so as far with picking up nonverbal reactions, how do you tend to deal with that when you see a patient maybe not as responsive, their verbal language is very closed up and, very, I don't want to be here, sort of?
Well, my approach is really actually very invitational. I'm not particularly confrontive or comfort. No, let me go back. I would say that I'm very invitational and not confrontational, which is not the same as I won't confront.
Yes.
But I'm not going to be really challenging, sort of dragging stuff out of a person. That feels really disrespectful to me.
Yeah.
So when somebody's really closed down, I invite discussion about the being closed down as opposed to open up and talk.
Yeah.
Just more like, really talking about what is the experience, are they, do they feel fear? Are they angry? Just talk about the emotions as they are in the moment as opposed to all the stuff that's behind those emotions.
Yes. As far as with eating disorders, how big of a role do you believe irrational thinking and irrational self-image plays with the part as being a therapist trying to help out the patient with that kind of thinking process?
Answer it. There's a couple of different stages in terms of how you're describing or how I'm hearing the description of irrational. When somebody's really, really what we call in their eating disorder, when their thought processes can become more distorted.
Yes.
And so it's sort of like the further into the eating disorder they are, the more distorted the thought processes, and the more we're able to help somebody walk toward a more recovery-based approach to their life and their eating disorder, the more we're able to engage actual cognitive frames and cognition, actually, to be actually really blunt. Like thought processes can be so distorted they can't even think straight.
Yeah. And do you believe that such stuff, because of their hunger and starvation when it comes with eating disorders, that has a big effect with not only their thought process but their ability to communicate the way of thinking and rationalizing?
Right. If somebody's really struggling with restricting, from my perspective, not a medical person.
Yeah.
I'm sure somebody in the medical profession can really straighten me up here, but just my experience of working with people who are really restricting, two things happen. One is sort of like the initial depletion of physical resources to feed the brain. So there's that, but then once weight really starts to drop, there seems to be like an additional difficulty, especially in processing emotions and experiences, and it's almost like the frontal lobes go offline.
Oh, okay.
Yeah.
They're just like,
So one is spacey because I'm really hungry, and that's really different from when somebody drops in their weight enough that it is becoming significant. It's like the body doesn't have reserves to feed the brain at all, and they really don't think well.
Going back to face saving, I know that clients really hang on to their eating disorders as their kind of identity. So how do you believe that makes them resist wanting to change and wanting to get out of their eating disorder?
Well, I think you used exactly the right term when you said identity. For a lot of people who struggle with eating disorders, there's a lot of identity wrapped up in, body image issues and, managing their emotions and their physical state, or their emotional state, with food. So giving up something around which somebody's identity is built is really it's scary.
Yeah.
And so when you use the word resistance, that can actually be used in a real negative way.
Yeah.
I don't. When I'm talking about resistance, I'm actually talking about fear about going into something that
Yeah.
seems like, you're taking away who I am.
Yeah, definitely.
It's
Especially
pretty
if
scary.
they've struggled with it
Yeah.
for a long time and lived with it. It's their way of life. So.
But a lot of people that I work with, they're really endeavoring to find a way
Mhm.
to let go. So again, with the resistance, I see it as not necessarily a negative. It's something to work with and not against. Helping somebody really start to separate themselves from the eating disorder, and that requires a lot of support on the other side, on their healthier self side.
Okay.
And not taking away, by the way, that's the important piece, not taking away
Yeah.
their eating disorder, but building up the healthy self enough that the eating disorder becomes something they want to let go of and find it easier to do.